Hey, everybody. Hope everything's going good. I hope you had a good holiday weekend. Let's go ahead and open it up to questions and answers. You can unmute yourself or type it.
And go ahead, Barbara.
Hey, Barbara.
Hey there.
Hey.
I'm looking to see if you can offer any guidance for my sister-in-law who's having significant respiratory issues. She has scarring in her lungs and emphysema, and what she calls is air trapping, which I think is difficulty. Yeah. And so I didn't know if the bronchioles blend or if we're looking at a bigger something for her.
And it's due to the emphysema, and she didn't have COVID or anything like that.
She's not had COVID. She also has an IgG deficiency, which has been treated and is in a better place. And she says her O2 sats are good.
Okay.
But she's short of breath and.
Yeah. Emphysema is a rough one. Most respiratory stuff, you kind of move straightforward with it, but emphysema, you have to kind of treat real sparingly and move forward. Just because like when you start to increase the function of the lungs and oxygen levels in the lungs, sometimes that can put a person with emphysema into a little bit of a crisis. And so the treatment has to be like little amounts at a time, and just make sure that she acclimates to it. And so I usually start with something really super simple, and you could do one of a couple of things. You could use the helichrysum, or you could use the Breathe Easy. Both are going to help reduce inflammation. The helichrysum will help reduce a little bit of the scarring a little bit more. But, right off the bat, just like maybe a few inhalations and then see how she processes it. And then if she does okay, then maybe bump up to like 8 or 10 inhalations and then see how she processes it. And then after that, like 15 or 20, and then just real small bumps at a time. She could rub a little bit of helichrysum on her chest, like after maybe getting it up to like 10, 12 breaths, but of inhalations. But just a little bit at a time, and she could probably do it multiple times in the day if it's okay. But every day, do it, but you can slightly increase it every day, but do it really slow, really gentle. I mean, like with emphysema, always err on the side of under treating rather than over treating. A lot of times, like if you have a pain syndrome or something like that, you can really kind of go at it aggressively. Emphysema is not one of those conditions. Like you have to be really super gentle. Yeah.
Okay, so she started with 8 to 10 inhalations for a few days.
Probably not even that many. Probably like 3 to 5. Like 3 to 5 inhalations, and then give it like a day or two of doing that, and then go up to like maybe 8 to 10, and then see how that goes. Yeah, it's got to be kind of slow. We're not sure how she'll process the essential oils. We're not sure how she'll process the reduction of inflammation and increase of oxygen levels. And so it just lets her body kind of acclimate. And so, I mean, the first goal is to stop the degeneration. Then after a little bit of time, it's like, okay, let's see if we can regenerate it and improve it. But, at first, you're just trying to stop where it's like how it's degenerating. And a lot of conditions, you don't have to do it that way, but emphysema is one of them. Yeah.
Okay, so she could do it more than once a day if she felt comfortable with it.
If it didn't throw her into any crisis, if she didn't have coughing fits, like, all the things that she knows what happens when there's the irritation. If she's okay with it, then she could just tell her to just slightly increase it, not massively. And then over a period of time, as because the lungs are kind of frail with that. And so as that increases and improves, you can go, bigger and stronger, but start just really soft, really gentle.
Okay, thanks.
Yeah.
We also talked today about her trying that marjoram for their vagal tone.
Oh, yeah.
Is that Can she do both at the same time?
Yeah, I probably wouldn't have her inhale that just because of the emphysema. So what you could do is like maybe put 3-4 drops and some lotion and have her rub it on her abdomen,
Okay,
or even on the low back. And if that seems to be okay, then increase it to like maybe 5, 6, 7 drops.
okay,
And again, lotion and rub it on the area and do that consistently. But a little bit farther away than like the chest, so that she's not overwhelmed with the fumes.
got it.
Yeah.
Thank you so much.
You're so welcome.
And then go ahead, Letty.
Hey, Letty.
Hi, Greg. Hi, Sam. Okay, so I have a quick question, Greg, about my brother.
Yeah, fire away.
So I know that he has there's a lot of things going on, right? But because he had a stroke and then, he's had that triple bypass. But what he's complaining a lot about right now is a lot of, like he doesn't have his balance. Now, I don't know if that would be vertigo or it's more related towards if it's more in relation to all the things that he's had, the stroke,
How's his blood pressure?
Honestly, I'm not too sure. I'll have to ask my sister on that to see. I guess we'd have to check it.
Okay, so let's run it down again. So he's had a stroke. And how long ago was the stroke? I know you've told me, but like, I'm not recalling it right now. Like,
it's probably been like, maybe 2 years, could be a little bit longer.
okay, so it's been a little while. Okay.
Yeah, it's
good,
been a
good.
little while.
And so, he had the
and now he
triple
does have-
bypass.
Yeah,
How
and then he
long
does
ago
have
was
that. I want to say he had the stroke, and then they kind of like also looked at him, and that's when they kind of decided that he needed that triple bypass. So I want to say they were kind of like within,
Okay,
close within
so-
each other. Yeah.
Like more than a year. Okay.
Yes. Oh,
Perfect.
for sure. Yeah, more than a year for sure.
So let's have you do so you have a couple of issues here, or I should say a couple potential issues, right? So first we'll deal with physiology, and then we'll deal with it like from an energetic point of view, right? So you look at it from the point of view of physiology. Like a lot of times when you have like dizziness, like loss of balance, things like this, it's tied to the constriction of the sternocleidomastoid, right? The muscles that are these two like rope muscles that come down from your neck, and they pass over the carotid sinus, and they do like kind of impact like some neurological function. And so they're also used in the elevation of the ribs to help expand your chest and help the respiratory process. And so a lot of times when you're dealing with vertigo and dizziness and like anything of that nature, which I would include loss of balance in this conversation, we always want to look at that. And so anytime the sternocleidomastoid is tight, usually the diaphragm is really super tight. And so you could say it's stress levels. It could be from an infection, from a lot of coughing. But here, it very easily could be because of the stroke or the heart procedure. I mean, it could be any of that. And so you have a couple things that you probably want to address. And so one is deepen the breath. And here I would go to I would stick with like hyssop decumbens, not regular hyssop, but hyssop decumbens, right? So either hyssop decumbens, larch, or you could use something like a Nula or Amivisnaga. And Anula and Omya Visnaga are very good antispasmodics. They're very good for relaxing the diaphragm. Anula is incredibly good for relaxing the diaphragm. It's a bit more expensive, so a lot of times I don't mention it. You know, I kind of go to the Hysops and the Larches and even Sitka, things like that. But here we're dealing with a very kind of severe case, and so I'd stick with Hyssop decumbens, you know, the ones that I just mentioned. Right, and one that can be a sleeper in this is myrtle or aniseed myrtle. Right, it's still myrtle, but it's just myrtle has a whole bunch of variations, and so the aniseed could be good in this area. Myrtle is also good for relaxing the diaphragm. A bit more gentler than some of the other ones. Like green myrtle is something we'd use to like treat that same issue, but in a child. And so it could be gentle. And the only reason I'm saying gentle is just because he's had a stroke and he's had surgery on his heart and all of that. And so it could be inhaled. It could be put on with like a massage oil or lotion, you know, several drops and rubbed on his chest and like the upper part of his abdomen, even on his back a little bit, if he has access to having somebody do that. That should be helpful. And then the other thing, oh, okay, so let me stop right there. So part of the issue sometimes is, you know, you have this thing in the back of the head called the medulla oblongata. And so part of what it's tied to is respiratory rate, like respiratory function, respiratory rate. And sometimes with all the stuff that we're talking about, that the medulla is like, it's functioning, but it might be like under functioning. And the vagus nerve comes out of the medulla, which is tied to like rest and repair. So, you know, this leads into the next thing that I was going to say is that the hyssop decumbens is good for stimulating the function of the medulla while also deepening the breath and relaxing the diaphragm and all that. And then the other component would be balancing out the autonomic nervous system. And usually when somebody would have a kind of imbalance that we're talking about, I would say, let's pull them out of, you know, the fight flight mode, that strengthen the rest and repair mode. But in this particular case, instead of using something like marjoram to balance that out, I would actually use anise. Anise, like a couple of drops in water taken daily, is very balancing to the autonomic nervous system, which is the involuntary part of your nervous system. So it's going to balance fight, flight, and rest and repair. And sometimes when you're going through like surgeries or you've had a traumatic event, the body goes into kind of a weird, you know, survival mode. And so, I mean, it's very, very common for there to be imbalances in the autonomic nervous system. And so, I mean, eventually I would say like maybe after a few weeks, you could start using marjoram to pull him out, maybe even a week, but I would try to balance out the nervous system a little bit at first. And so is he getting headaches, by the way?
I don't think so. I don't
Okay.
think so. He doesn't complain of
Good.
headaches.
That's a good sign. Okay. So let's stick with the anise. And if you don't have anise, the other one that works really good for balancing out the nervous system is yuzu. Yuzu is really good for that as well. I mean, they're kind of equally as good. And so if he doesn't like the taste of one or something, because he is going to have to take it internal. Like if he doesn't like the black licorice taste of anise, then a couple of drops of the yuzu, and it's a real kind of mild citrusy taste. And so I do that for a little bit. And you could always do things that are kind of calming and soothing to his body, you know, that blend still point. That does just agitation in the body. So he can inhale that, or you could rub it just on any parts of his body, you know, like in a little bit of massage oil or a neat application. You know, it's blue, you know, it has a dark blue, it has blue oils in it. but it's just you're wanting to start calming down a lot of the agitation in the different systems. So you could use that, or you could put something like spikenard or valerian on the feet, like a bunch, like 10, 15 drops, and just, have somebody rub it on his feet. And, every night as he's getting ready to go to bed, he could do that. If he's not going out and about and he's just, he's at home, I would do it throughout the day. Like I would keep him in a more relaxed state over a period of time. And as time goes by, you can start to adjust it, but it's almost like you're having to do a little bit of triage right now. And so let's have you do that. Like from the energetic point of view, in case you're doing other modalities like energy healing or something, his Ming Men is really super overactivated, but just treating the Ming Men probably isn't going to be enough. And so, this is one of those times where the energy healing and the oils would work really well together. And so I would do a lot of general sweeping, and then spend a lot of time cleaning his diaphragm. Like, you would go in through the solar plexus and just kind of anchor up a little bit and then clean that up a little bit. Part of why the nervous system is out of balance is the tension that's in the diaphragm. And part of why the Ming Men is overactivated is because of the imbalance in the nervous system. And so by going through and doing that, just treating the Ming Men will help a little bit, but it probably won't last very long. By going through and doing this other stuff, it will help quite a bit. You could always put usually I would say put mugwort on the arms and the legs, but here I would say let's do like something like spikenard or valerian or vetiver or rooskous, something really deeply relaxing. And he could do that multiple times in a day. But as you begin unwinding it, then eventually I'd have you follow up with, as the symptoms reduce, start using Gilead on the arms and legs or Palo Santo, right? Either one. And the issue being that when the body is in such a crisis, you begin unwinding the body, and there's the psychological responses of the stress or the fears or anything like that, but your body generates those lower emotions that we're always talking about. It generates a lot of lower emotions when the body's in crisis because it's trying to get you to take some sort of action to thrive in the environment. And so when your body goes into a crisis, your body generates just a bunch of lower emotions. And it might not even register to your brain, but your body is generating them, right? And so because of that, as you go through it, unwind that, then the next step is undo all those old emotions. It's not emotions that he psychologically generated. I mean, there's going to be some there because he went through a couple of crises, right? But because of the crises, his body it might even still be generating the lower emotions. That's the thing with like really chronic health issues is calming down those lower emotions and clearing them out usually allows for the body to heal at a much faster rate. And so especially, it's one thing to be like, over a period of time, your body degenerated and there's a bit of a chronic health issue. Here you have two incidences where it was like 911, like boom, he had a stroke, and then boom, gotta go in and have this surgery, gotta have a bypass. Those are extreme and very sudden. Like it's kind of like an all or nothing thing, twice in a row. Your body just goes nuts with that. Like, there's the parts that are trying to heal and stabilize the situation, but your body just starts to generate a bunch of emotions. So the more that you can calm all those things down, for one, he'll feel better emotionally, mentally, but his body will start responding to a much higher degree to any sort of treatment. But you almost have to walk it in like the way we talked about how to start it, like go through, deepen the breath a little bit, start unwinding the diaphragm, start balancing out the nervous system. If that starts getting all balanced, is he having anxiety?
No, not that we can tell.
Okay. Is he on medication?
Yeah, he's on medications. And that was going to be my other question, like with all the meds that he takes, because, you know, he takes like the one that they always give for neuropathy.
Right. Yeah,
I forget. Yeah, that one.
Yeah.
And we're trying to get him off because he was taking a lot of it, and then it makes you kind of loopy. So we're trying to get him off of that, and that's why we're using more like the vetiver spray and the lymphatic blend.
Perfect. So none of that should impact his medications. None of the things that we're talking about. You know, the big one to stay away from for potential interactions with his meds. You know, I don't even know what he's on for his heart or anything, but anytime there's substantial heart medications being done, not necessarily like blood pressure or something, but like when there's a substantial heart issue, stay away from grapefruit. And grapefruit's not bad for the heart. It's actually good for the heart, but sometimes it neutralizes some of the medications. And so we don't want to have any crossovers, right? And so yuzu won't do that, but you know, for whatever reason, don't use grapefruit. There's no grapefruit in anything that you were just talking about. So I'd stick with what you're doing. You know, if he's having short, rapid breathing, the hyssop decumbens should be helpful. But sometimes when the breath is just really super rapid, just like bam, 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 like, you know, he's not breathing very deep, but he's breathing very rapid. That kind of goes in hand with like balance issues and dizziness and things like that. The anise should help. The hyssop should help, but sometimes you might need to augment that with some Lang Lang. And again, he would just inhale it. Like just take some long, slow, deep breaths with the Lang Lang, and the Lang Lang will slow down the rapid breathing. The hyssop decumbent should, the anise should, but if it's still not slowing down, the Lang Lang will do it. The Lang Lang will also like kind of calm the heart muscle a little bit, and so that can be helpful. You know, Lang Lang can be used to treat like kind of mild forms of tachycardia. Like I don't know what his resting pulse is, but it's probably either, you know, probably high. And so if it's regulated, it won't drop it a whole bunch. But if it's really high, sometimes it will drop the pulse rate down a bit. But if it is high, he's probably on medications for that. So it shouldn't interact with any of the medications. There's been times when somebody has had that issue where I've even had them take a few drops of Lang Lang a couple times a day, and that can be helpful. You know, Lang Lang is good for the heart. Neroli is good for the heart. Is he having any like not necessarily chest pain, but is he having like achiness in the heart muscle? Like a lot of times, like, you know, chest pain feels like pressure on the chest, but sometimes when the heart has just been stressed, or like, you know, how we have poor lymphatic movement in the body and it aches, the same thing can actually happen to the heart muscle. And so I would also see that because it actually can produce a little anxiety. It can make him a little bit uncomfortable. If that is the case, use like some form of pine, like pine on the chest, and that could be quite helpful. You know, Sylvester pine can help. The one that I use a lot is either Sylvester pine or Jack pine on the chest, like just several drops on the chest, and it's just it helps to detoxify the physical heart a little bit. And it, according to medical aromatherapy, which is usually done by physicians, they say that it changes the pH of the heart muscle itself a little bit. Not massively, but enough to take that ickiness out of the heart muscle. If he's having pressure on the chest, he needs to tell his doctor about that. But it possibly would help with that as well, but it's more about the heart muscle itself.
Okay, thank you, Greg.
Yeah,
That's
you're
all,
so welcome.
that's a lot of info there. So
Yeah.
I'll go over the notes again and start him on some of the anise drops and water. We can put those in capsules, right?
Yeah, that totally works. Yeah. I mean, I do the anise drops from time to time, just to, like, maintenance. Like, it's not even like I'm going, oh, I'm starting to have symptoms. One of the symptoms that you'll notice that, like, when your nervous system is a little bit out of balance is you'll start gulping air, like when like with your mouth. Like, you'll start gulping air, like when you're eating or drinking, or you'll be standing there and you'll just go like multiple times in a day, like where you gotta, like, all of a sudden take a deep breath. It's usually associated with a little bit of anxiety, but it's actually even deeper, more of an imbalance in the autonomic part of the nervous system. And so the anise will help balance that out. People usually don't think of it as being an issue. Like you could say it's an issue because it starts to cause, like, digestive issues, but more than being a thing for digestive issues, it's an indicator of neurological imbalance and potential for anxiety. Usually when somebody's doing that, they're anxious, even though they might not be aware of it.
Okay, thank you so much, Greg.
You're so welcome. Hey, and keep
you.
us posted, Lynn.
I will. Okay, thank you.
Stand by with me, guys, for 1 second. I'm just gonna mute us here just for a second. We are still here. I'll just be right back.
And that's the secret to life.
I just had to get the secret of life out of him. Sorry, guys. No, just kidding. But Robert, go ahead.
Hey, Robert. It was super good seeing you this last weekend. I got to see Robert in person.
It was good to see you. Sorry, I wasn't ready for my question to come up. Had a great time Saturday. Thank you.
Yeah.
I have a client who was just told via an after visit digital report that she has COPD, or the start of it. Is there something simple we can do for her?
There is some, like, let me look it up. There is, like, a little something I think we can do with it. Give me a moment here. Like, bear with me. Where did I have that COPD? Do you remember?
I don't, but it was kind of recently.
Yeah, it was recent. It's funny because we were talking about this, like, just not too long ago. And so give me a second to see if I can find. COPD. Okay, it's not there.
Maybe it's just under the stuff.
Under what? No, it's something different. See if I can- just a second longer here. Okay, so I would probably, I mean, we're gonna have to kind of treat this a couple different ways, and just see what kind of hits. Okay, let me look up one more thing. Okay. I'm going to give you a few choices, and I'm going to start with the first one, which is probably the one that I would start with, and then work my way down. I would probably start with marjoram. And it could just be inhalation, and if she starts to respond well with it, you could still do it, and then still have her inhale, and then make it into a lotion, and then rub it on the chest. If that's not working, I would probably switch to like green myrtle. If that is not really helping a whole bunch, then let's have you switch to like a pine or a terebinth. But like, I'm with you on that. I'd keep it really simple and go through and treat. I mean, I always look at the diaphragm, always like look at, you know, the bronchioles, you know, like in the throat minor area and the upper part of the respiratory tract. But a lot of times I treat COPD a little bit like how I treat whooping cough, you know, pertussis. Like I'll treat it a little bit like that. And so marjoram is really good for that. And so the thing, like whenever you have like a significant kind of respiratory issue, it also throws off the nervous system. And you know how we were talking about anise for the last condition that we were talking about. Here I would go right to the marjoram, like, you know, help pull the body out of the sympathetic activity, try to stimulate the parasympathetic activity, things like that. Like a left field thing you could try, if she doesn't respond to any of those, is lemongrass. You know, I would give that a shot. They'll usually notice, like if she's there in person, you could put one in front of them and let them start inhaling and see if it starts to change. And then if not, rotate the next one, and then the next one, and the next one. But we'll need some long-term treatment, you know, because that's a pretty chronic condition. But you know, in some of these cases, you kind of start treating and just see what the person responds to. Because there could be other factors and things, and it's hard to go through and evaluate all of them. So sometimes I do like a quick evaluation, and then I just start treating and see what they respond to. And then that helps me to refine what is going to be like a deeper treatment. So the treatment at first is kind of part treatment and part evaluation to see, you know, what avenue is going to really help. And then you can go further down that rabbit hole. But those would be the ones that I would start with.
Okay, and when you say long-term, what does that mean? I understand it'll take time, but are we talking months or years?
It depends on how bad it is. Definitely months, but it might be something that she needs to treat even for a couple of years. It might not be that she treats it every day, but she'll need to do tune-ups from time to time. And, you know, it depends on how bad it is and how long it's been there. Like if it's been there a really long time, it's probably gonna be more than a year of treatment. You know, it doesn't mean every day, it doesn't mean every week, but it's going to be consistent.
Okay, and then you gave, I think by my count, 5 oils to try
Yeah.
in order, and if they work, stick with the one that works, but if it
Yeah.
doesn't, go to the next one.
Yeah,
Marjoram, green myrtle, pine, terebinth, and lemongrass.
right.
And she loves lemongrass, that much I already know.
Yeah. Oh. Yeah. So if she's already using lemongrass, I mean, I'd keep it in the mix, but I'd start with marjoram.
Okay, great.
Yeah.
Thank you.
Yeah, it was super good seeing you too. Ron.
Yeah, a lot of fun.
For the inhalations for that one, like the regular amount of inhalations? we
Yeah,
do?
regular amount of inhalations. Don't really necessarily have to follow a pattern. Just get them inhaling it. Over a period of time, you can start directing them to treat different patterns. Basically the respiratory pattern, or I think we call it the sinus pattern. But at first, you could just have them inhale and just see how it responds.
Okay,
Yeah,
thank you.
you're so welcome.
And again, you guys can always raise your hand or type in. How can we identify the type of oil, whether it's strengthening, whether it's clarifying? Is there a list available for this? They didn't specify what they were trying to treat or anything.
Yeah, you'll have to be more specific.
Hello, can you hear me? It's Heather.
Great.
Hey.
Thanks, Heather. Glad you're here today.
How are you?
Doing excellent. How are you?
Good, doing very good.
To clarify that, I wasn't trying to treat anything specifically, but when you speak, I hear you say a lot of, and you use something that's strengthening or clarifying, toning, all these little terms.
Mhm. Sure.
And I don't have the knowledge to determine, okay, if I want something that's strengthening, I would use either
Yeah.
A, B, or C. Is there any way to kind of put it
Yeah,
into something?
so
listed?
actually, I'm in the process of preparing that for you guys. I have a significant amount of notes put together for that. And actually, I broke it down to calming agitation in the system, going down and doing purification, fortifying,
Mhm.
regenerating, raising the vibration, also allostasis, which is helping that particular system to change, and then also to stimulate that system. So you're starting with agitation, which would be basically calming down that system, and then you kind of work through that whole spectrum, ending with how to stimulate more appropriate function. And so I have probably about 20 different classifications, maybe 22 different classifications, and I need to write down the definition of what each of those are, but that's something that is going to be coming out to you guys with the notes that will come out in the middle of June. I was hoping to have them done a little bit sooner, but with all the travel and everything, I can't keep up with the writing sometimes. But a good amount of it's already actually done.
Oh, excellent to hear. Yeah.
Yeah.
I look
Is
forward
there
to that.
anything in particular you're wanting to address, or you're just wanting some general notes?
It was just more general because it's
Yeah.
every
That
time
was-
you say it, I go, well, I couldn't
Yeah.
identify that if I wanted.
Right.
Um,
So that's also because regeneration is a perfect example. Regeneration has several different meanings depending on what you're talking about. If you're talking
Right.
about regenerating a joint, that is increasing blood flow. But if you're talking about regeneration that has to do with the nervous system, it's actually about re-educating the nerve and how it's firing. And then if you start to look at some of the mechanisms for lower emotions or the instinctive mind, it's making the lower emotions or the instinctive mind go back to a proper way of functioning rather than a way of functioning that has been because of a trauma or agitation or whatever. And so I didn't want to just list all those things. I wanted to go through and write out what each component like meant. And then that way, like present it to you guys and then have you be able to go through and troubleshoot. And so we have a class coming on Father's Day weekend. And, you know, I did horrible with the description, but basically what the description is, we're just going to do it right now. So,
Oh, excellent. That was going to be my next question.
yeah. So the description is basically your question is the weekend. Like we're going to
Okay.
go through and I'm gonna give you guys a bunch of notes of like how to troubleshoot like different conditions, different like systems. And then like each system is going to have like how to treat agitation, how to fortify it, how to re-educate it, how to raise the vibration of it, whatever it is. So I'm basically going to give you guys a booklet that's just of like all the different systems and then like how to go through and treat it with an explanation of what each component is. And then we're going to talk about it through the weekend. So that weekend, it's a free weekend, by the way. That weekend is not going to be a lot of like us sitting and doing protocols and everything. It's going to be a lot of just lecture and Q&A with you guys. Like it's basically going to be kind of like what we do tonight, but for a weekend, but like kind of guided of like, we're going to talk about respiratory system. We're going to talk about digestive function. Like even in the nervous system, we're going to break down different parts of the nervous system. And then even there, like we might focus on like the basal ganglia and why to treat the basal ganglia and you know, what oils are going to work for the basal ganglia. Like, I don't know why basal ganglia just jumped in my head, but but basal ganglia has a lot of things. You know, you have like restless leg syndrome, you know, issues like that. But also basal ganglia is tied to repetitive thinking, like you know, when you have thoughts that run through your head over and over again in like a loop. And in the extreme kind of agitation in that particular piece of anatomy is it will produce OCD. And so OCD is very, very hard to treat. And, you know, the issue is that a lot of times we look at it as a psychological issue when it's probably more neurological than psychological. I mean, there's some psychological components to it, but it's a good piece of it is neurological. And so it has a lot to do with like conditioning on the nervous system and the body and even some of the lower emotions. And then the basal ganglia just keeps drifting farther and farther away from where it should be for normal functioning. And so how do we calm it down, improve function, but get it back to where it should be functioning? And so we're going to go through and we're going to talk about a whole bunch of things like that. And so you know, between that class and the class with the Sandalphon healing technique, I'm really trying to gear it so that you guys can treat, you know, things without even sometimes having to really be able to diagnose or evaluate. You can kind of just like listen to a few symptoms and go, I'm just going to go through this set of protocols and go through and treat. So you can do like a blanket approach. You can just start identifying systems and starting to treat. The Sandalphon technique is going to be about doing it, but from an energetic point of view. And so those 2 weekends together, anybody who wants to be like a aromatherapist and do it like either by itself or integrated into another healing modality. I'm trying to make it like a turnkey situation for you guys. I mean, the classes with all the protocols and all the patterns, I mean, I love them. I think, you know, we do a lot of different things in the classes, but this is just going to be bread and butter, everyday things. Like, how do we go through and treat these things? And so if I get it done before then, we'll get it out to you guys. But the goal was like about the middle of June. You know, well, I got to have it done for that weekend, so it's going to be the middle of June.
Okay, that'd be awesome.
Yeah,
You know, as you ask if I have something specific, it did come to me. I injured the tip of my finger where I had a splinter in it for at least a good 2 weeks, and then I finally was able to remove it. Just tiniest little thing. But now I notice I must have some type of nerve damage or something because it's the tip of my index finger is sensitive to cold, whether it's just temperature in the house,
that-
outside, or holding
neurological.
a cold drink.
Yeah, you're
Okay,
right. Like the nerve got irritated a little bit. So you have a couple of choices there. I mean, you could experiment with a bunch of things, but this is where I would start experimenting. Is I would either use some form of like regular sage or Spanish sage or sage trilobo or Dalmatian sage. The different clary sages probably won't do it, but just the standard sages.
Okay.
You just put it on meat on the area and even rub it like past. And sometimes like when it's the fingertip, I still kind of do like maybe the palm and even a little bit in the forearm, but like an area that really gets impacts the fingertips, even though you had a splinter there, right? Still like kind of treat in between the bones on the hand. Like, so what you can do is you put the oil on and then like kind of pinch, like, you're pinching between those bones and you're just trying to loosen those up a little bit. And it probably isn't being caused by anything there, but the more that you open that up, the more that the nerves function better, like further down, and here it's down the finger and into the fingertip. And so the sage should help to re-educate it a bit or calm down that sensory nerve, or chamomiles, like Roman chamomile, Cape chamomile, German chamomile, something like that. If you don't have that, also milfoil, like, which is a type of yarrow. So still kind of in that genre, but they're antispasmodic, they reduce inflammation, and they have a re-educating effect on the nerve. Sage is really good for that. But, sage will really calm down overexcited sensory nerves. Like if you don't have any of those, you could even try to go to like vetiver or something like that. But between all of that, it in theory should calm it down.
awesome. Well, I have good old fashioned sage.
Oh, perfect.
Great, thank you very much.
You're so welcome.
And so we have a few questions from that real quick. So let me jump up here just to address those. When is this amazing sounding weekend?
It's the Father's Day weekend. Yeah. The Sundathon class will be the weekend before, right? And then saying this, but let me double check.
June
Yeah,
11th and 12th.
Sundathon is 11th and 12th, and then Father's Day weekend is the study group session that we're talking about, and it's the 18th and 19th.
And
So
I will get that up on the site, guys.
Yeah.
And it'll be free and it'll say study group, and you're hearing of it first. Okay. Now, as far as the Sandalphon weekend, isn't it the Angel Sandalphon class? Is there a difference between?
It's actually a technique, and so this isn't so much about. It is working with the Angel Sandalphon, but it's actually preparing the body, the energy body, to handle change, to handle more higher vibrational energy, more essence. So it's used to treat physical conditions, psychological conditions, prepare the body for spiritual energy. And so the Angel Sandalphon is the angel associated with the basic chakra, which has to do with the body and the form. And we will be using that, but we're also going to be doing different things to unwind the different layers of the energy body. And so we're going to be doing a whole bunch of different combinations, and it's not just going to be the aura. We're going to unwind things in a Kabbalistic way and balance out different energy centers, like balancing out the heart and the solar plexus, balancing out the forehead and the ajna, which is forehead would be awareness, ajna would be focus. So balancing them so that they're more harmonized and not so polarized. And there's a really deep way to unwind the energy body actually quite quickly. with this. And so there's going to be a bunch of different protocols that all stand by themselves that utilize that, and then talking about how to use the different blends for using them for salt baths, using them for like massage or like ointments, or even incenses. Like, you know, you can unwind this just by even burning a stick of incense in a sequence over several days or something like that, and go through and unwind it that way. And so even in the kit, you're getting a whole bunch of different kinds of incense to be able to treat yourself or treat somebody. Like say you're doing talk therapy or energy healing, you could burn a stick of this incense as you're going through and doing the energy healing to deepen the effect, or while you're doing the talk therapy. And so we'll talk about the different layers of the aura and then how to go through and treat them.
Thank you.
Yeah, so like one weekend is like the energetic approach, and then the other weekend is just the clinical approach. So I'm giving you both sides of the coin.
Will the free study group have an oil list?
We're going to be doing more lecture than anything, and so like if you have a bunch of oils already, you're probably good. And so like I'm trying to give you like things to draw upon that you can do from your toolkit. Yeah, it's going to be a little bit different than how we do some of the other classes. There's going to be a lot more like how we're doing right now. A lot of Q&A, a lot of talking. You know, we might run through a protocol or two just so you guys have an experience, but this one's going to be more about just answering questions, giving information, helping you problem solve. It's going to be more talking than inhaling.
Other questions? Should one take a periodic break from daily Monarda, or daily ongoing basis is okay?
Daily ongoing basis is pretty okay. You know, if you're feeling pretty good, but you still want to do it, one of the things you can do is rotate it. But given how, you know, the viruses have mutated and there's just a bunch of funky things going on, not just COVID, but, you know, other things. You know, somebody reminded me about 11 years ago, about 10 years ago, I talked about how there was going to be a phase where there was a lot of mutations and viruses and bacteria. And it was based on some science that had to do with solar flare activity. And, you know, if you watch solar flare activity over a period of time, and there's a lot of activity, one of the very first things that happens is there's mutations in viruses and bacteria. And so the sun goes through these cycles, and I can't remember, I want to say it's a 9-year cycle, could be 7, but I want to say it's a 9-year cycle. So some of these cycles are very normal, and sometimes they get really hyperactive. And we were coming into a phase where the cycle was going to be more hyperactive. So the potential for mutations in viruses and bacteria was a bit more substantial. And so with that, keep your body pretty strong when it comes to anything antiviral, antibacterial.
I have a friend that has a 5-year-old son that's been diagnosed with dyslexia. He was born very premature. He's physically okay now, but has this learning disability.
Mhm.
What would be the best oils and energy protocol to help?
Yeah, so Roman chamomile would be really super good. Part of what happens is when you look at something like dyslexia, basically there's so much agitation in some part of the body. Here we're talking about the nervous system, where you're starting to have a paradoxical response. And paradoxical just means it's the opposite of what it should be. And so that is what happens with dyslexia. So you have a couple of things. this is really weird, but is the child like Caucasian? Is he white? Or she or whoever it is?
Hispanic.
Hispanic, okay. The reason why I'm asking if he's Caucasian or she's Caucasian, whoever it is that there's this anomaly with it usually only happens in Caucasian people, but like they have to be like very, very white, like not like with a little Asian blood or a little Hispanic blood, like it's like they're just very, very white. Usually from Scandinavian countries. What happens is the eyes get overstimulated by light, and it actually causes like a flip in the brain. And so that is always a potential. And one of the ways to remedy it is different colors, like glasses, or you put film over the like what they're reading, and it's going to be different for everybody. Like it might be yellow that works for it, might be blue, might be pink, but it basically calms down the brain so that they don't start flipping everything. And so you can always explore something like that, but with the child being only 5, I would say a lot of things like Roman chamomile, like rubbed on the body, inhaled, like salt baths. And this is going to be like often, like this is going to take a period of time. Roman chamomile and blue tansy, but you know, we have 2 blue tansies. One's a dark blue and one's just regular blue tansy. I would use the regular blue tansy for the child, but you could probably just get away using the Roman chamomile. And it calms down some of the agitation while helping to regenerate the nerve. So that could be very, very helpful. Given their age. Sage would probably be a little too strong. It probably wouldn't be therapeutic. Mandarin. Have them use Mandarin. Like, so you could use chamomile and Mandarin. You could also use some lavender just to keep the child like calm and soothed, especially at night. All of these would be like inhalation, a little bit rubbed on the body, or a few drops in their bath. If the child has the tendency to have like emotional outburst or like, you know, crying fits, anything like that, the chamomile should help. The Mandarin might help. The chamomile should probably help more, but in extreme cases, we do have to use like Melissa sometimes. Melissa is quite expensive, and so I wouldn't start with that. Like I would use that like as the last resort. Chamomile, not that expensive, and you could use it for quite a while and not have to take breaks from it, anything like that. So that's probably where I would start.
And we have different mandarins, just the red mandarin.
Yeah, any of the mandarins would work. Yeah, red or green. Yeah.
And we have a pettigrew mandarin. Is that different?
Yeah, I just do regular mandarins. Yeah, good question.
Is there a protocol for sudden hair loss?
Sudden hair loss. I mean, you could try essential oils, but honestly, what I would probably do is start taking some collagen. You can get, what's that company that we get that collagen from? Do you remember? You can get collagen like in capsules, and then you get liquid, and we get these like little chews that you just, you chew 2 or 3 of them. And a lot of times when you have like when it's really sudden hair loss. It can be a stress on the body, it could be a hormonal imbalance, could be a vitamin C deficiency that is destabilized basically the collagen levels in the body. And so you supplement the collagen to offset that, you know. Now, like if you have like male pattern baldness or something like that, it might help, it might not. Probably won't, you know, the collagen won't, but if all of a sudden the hair just starts falling out a lot, the collagen usually will knock that out. I mean, it's bizarre. Like you do it for like 2 or 3 days and it will like stop. But I would do it for like a month or 2. And then if the condition is resolved, you probably could stop after that. But if there is like an underlying issue that still kind of is there, then you know, like could be inflammation, could be some other kind of health issue, could be an endocrine issue. Keep taking the collagen for a period of time. Yeah.
Because I'm under a lot of stress.
Yeah.
I'm a female, I'm 51 years old,
Yeah.
and it's not in my family.
It's the collagen's destabilized. Like just get some collagen. I mean, there's all kinds of things you can try to do topically and everything, but honestly, the collagen usually works the best and the fastest. You know, you could try oils and everything, but you'll have to shampoo all the time, and it might work, it might not work. The collagen, I mean, like 80-90% of the time will knock it out like pretty quickly. And the other benefit is it makes your nails better, makes your nails stronger, it makes your hair better, makes your hair stronger, gives it a little bit more luster. It doesn't break as easy, doesn't get the split ends as much. It's even if it doesn't do it, it makes a bunch of other things healthy, but honestly, almost 90% of the time, 85% of the time, the collagen is what knocks it out. So that's what I would do.
And then go ahead, Robert.
Hey, Robert.
Back again with another question, follow up
Yeah.
from one of the earlier ones. Different ages of kids, when should we not use oils? What oils should we start using at what ages, and what ages can we use pretty much anything?
Oh, great question. Great question. Okay, so usually when the child is around 9 or 10, you can start treating them like an adult, but maybe just not as big of dosages. But the rule of thumb, like for children, I think we even have like a children kit, don't we? Like on the thing. And so it's like, it's instead of using something like eucalyptus or peppermint or something like that for respiratory issues, for children, green myrtle works the best. I mean, green myrtle just rocks it, right? So green myrtle, Roman chamomile for inflammation, spasms, colic, you know, emotional outbursts, you know, if they have even bad dreams, sometimes it will even help with that. That or Melissa. Melissa is really good because it's very soothing to the nerves, but it's also real pricey. So, you know, I don't think we included that in the kit just because we tried to make it price effective. But so Roman chamomile, mandarin is very good for soothing the child. It's antispasmodic. They usually like it. It can reduce anxiety. You know, it's kind of stimulating to all the body's processes, but not like how caffeine or sugar would be. It's just like how peppermint stimulates the body for an adult. The mandarin does it for the child. Thyme linalool. Thyme linalool is really great for fighting off infection in a child. Also really super good for treating liver issues in the child. I've treated, you know how sometimes babies are born and they have jaundice? I've treated it with thyme linalool, and I mean, it consistently works. And every once in a while it doesn't, but for the most time, and it's gentle enough to where you put like a drop or two in water and shake it up, and then just give them like a spoon or two. You know, you don't give them the whole glass, but you just give them a spoon or two, and then you do it a couple times in the day. And it will actually help improve the liver function kind of quickly. Lavender is like your go-to thing with kids. It's soothing, it's fortifying, it's super relaxing. You know, for like adults, one of the strongest sedatives is like spikenard or valerian. Lavender is that, but for a child. Like different lavenders, they all work, but the one that works really super well for children is lavender malleate. Like it's probably one of the more soothing lavenders that like soothing being like relaxing, and just kids respond really well to that one. That one and I mean, it's usually that's the one that I use. Let's see. African bluegrass also works for like if they're having like mood issues. Like it's very soothing. It calms down agitation in the child, but like you know, say it's like bedtime and they got to go to bed and they're kind of pitching a fit and they're a little bit rebellious and you know, you got to wrestle them into the bedroom. If you start like diffusing African bluegrass in the environment, like within a day or two, I mean, they just kind of start going, okay, it's time to go to bed. Like it really kind of shifts them around. So if they also have like mood fluctuations, the African bluegrass works quite well. We use bluegrass a lot when there's those kind of mood type issues in the child. That works. Am I missing one?
I can look at the kit if you'd like.
Yeah. We're looking up the kit just to see what else is in there.
Okay, and so to clarify while she's looking it up, this is for kids 9 and up generally.
9 and under.
Oh, 9 and under. Oh, okay.
Yeah.
Perfect.
9 and up, you just treat them like an adult. You just give smaller dosages. Yeah.
Okay.
But like, and here's a weird thing with kids. Like, if their bodies are bigger, like say at 7 or 8, like, you know, you have a big kid, like he's already getting tall and, you know, starting to fill out, you know, be it a guy or a girl, that age can get, you know, you can shift it sooner. But with a child, you know, because part of it is physiology and part of it is energetics, and the energy centers for a child are dependent on the size of their body up until about 7 or 8, and then they have chakras like an adult would, and it has nothing to do with the size of their body. But when they're a little baby, their chakras are tiny. As they start to get older, chakras get a little bit better. So that's not just an energetic thing, that's also like a physiology thing. Like they can handle things better as they get older. And so 9 and under, just stick with these kind of handful of things. I mean, there's always situations where you might have to do something different, but things that we would use as adults sometimes are actually counterproductive in treating a child. Perfect example is like peppermint or eucalyptus. Yeah, you would think, oh, it's good for the respiratory issue. Too overstimulating to a child, like just way too overstimulating. I mean, you put it on and it's not like it's going to cause a bunch of damage, but you're trying to treat like a respiratory issue. It might actually make the breathing worse, not better. So
Okay.
green myrtle is very soothing. It opens up the chest. It relaxes the diaphragm, but in a way that's very soft and gentle. Sometimes with skin issues, I still do lavender and chamomile for children. You could go to Kunzia if you needed to, but other than that, you know, unless there's some special situation, those are the handful of things that I would use for treating a child.
Okay, I found the kit contents and pasted it in the chat.
Oh,
and
tremendous.
you did all of them.
Yeah, good.
Thank you.
Yeah, you're so welcome.
And then we're just gonna go back really quick.
You know, like one more thing on that. So Melissa is really good for children. It's just that it's really expensive. It's crazy expensive. You can get like a tincture, like a glycerin-based tincture, so it's not alcohol-based from the health food store. They don't always have it. You might have to order it. That could be a good supplement. And we also made like a spray where it's Melissa, but it's not, you know, not crazy expensive. It's affordable. You could just, it's like spray it on the child and then kind of rub it on, kind of like a liniment. We made that Melissa spray specifically for dealing with children, and very calming and soothing to the nerves, very fortifying to the nerves. If they have nightmares, it's very good for that. Chamomile could be that way as well, but any sort of emotional, like, you know, fluctuations or outbursts, bouts of anger, I usually go more to the chamomile than the Melissa, but the Melissa is very fortifying to the emotional body and to their nerves. I usually just use it in extreme cases, but I wanted to throw that in there in case you're having a troubleshoot an extreme case, so that you have something that you could draw upon.
Thank you much.
You're so welcome.
Right. Someone wanted a little more specific potential here. Just lost it. For the child that has the dyslexia, they asked that I look at them specifically and see if it was something specific for them you would recommend. His name is Lucas Rodriguez, the one that's the 5-year-old who's dyslexic.
I'd stick with I think we said chamomile for that. You could add mandarin to that as well. The child looks like it's a little bit anxious. I don't know if it's causing the dyslexia, but it would help calm them down. And then at night, you could add a little lavender just to make sure that they're, you know, a couple drops in lotion, like on their chest or their abdomen, or a little few drops in a salt bath. Or you could even just diffuse it in the area. Just help them sleep and make sure that the sleep cycle is going good. Like, so then when they're asleep, they're really asleep, and when they're awake, they're really awake. Sometimes, even though the child might be sleeping, they might not be sleeping deep enough, which can also throw off the nervous system. But there does look like there's a little bit of anxiety. It could be from all kinds of things, and it could just be from agitation and some of the physiology of the child. But you know, that combination should help substantially. If it doesn't, let us know. But I mean, give it like a month or so. Like, it's going to take a while of treating to really start to shift the dyslexia. You know, and it's something that you'll treat over a period of time. But this kind of combination, if it starts producing a result within about 30 days, just keep doing it, and a lot of times it will diminish substantially.
Thank you.
Yeah.
Go ahead, Chris, then Letty.
Hey, Chris.
Hey, Greg. Hey, Greg. Thanks, Sam. Hey, I'm trying to help a friend out. Her daughter, who I think is in her mid-20s, is entering her. She's going to be celebrating her birthday in a couple days and entering her Saturn cycle. And she's an AY practitioner and has Asperger's, and I think she's making herself sick of worry. She has a cold and flu-like symptoms, but not COVID.
Yeah. I would probably go to like cinnamon, cassia, something like that.
Okay.
Yeah, because you have a couple things there. So for one, it makes them not so introverted. And two, it's strengthening to the body, makes them a little bit more thick skin, not as sensitive to the environment and to other people and things. And then it also stimulates the immune system and is very good for fighting off like infection, contagious diseases, things like that. So you kind of hit everything with just a single oil.
Oh, okay. Great. And in terms of pH, is there anything aside from the solar plexus? And
Shrink shrink the forehead, shrink the front and back solar plexus, shrink the main men, shrink the perineum, the soles of the feet, and the jaws.
okay, just blew it.
Yeah, clean them up a little bit and then, yeah. But you'll
Okay.
you'll kind of have to do it because so here's the thing with that. You know, going back to the basal ganglia. So sometimes what happens is the basal ganglia will make you a bit like when there's some agitation there, it will make you a little bit hypersensitive or hyperreactive. You know how like you would say about somebody like, oh, when I'm around that person, I have to walk on eggshells, or they're just like hyperreactive.
Right.
Yeah, that's still a little bit of a basal ganglia issue. And so the very first thing that I do is like go through and just calm it all down, right?
Mhm.
Excuse me, calm it all down. Then after that, after you've calmed it down, then you go through and like clean it up. And so you can go through and start cleansing it, but like do a couple sessions of just like calming it down. Like as soon as everything's calmed down, then that same pattern, but with now electric violet, but the focus is always, regardless of where you're treating, it's always on the basal ganglia. Like if you're on the soles of the feet, you're treating the soles of the feet, how it impacts the basal ganglia. The Ming Men, how it impacts the basal ganglia. Solar plexus, how it impacts the basal ganglia. You know, with plants, the plants will kind of do it because of their properties, but when you're doing it with energy, you have to direct it more.
Got it.
Yeah.
Thank you so much, Greg.
Yeah, you're so welcome. That should make them feel a lot better.
Thank you.
Go ahead, Letty.
Hey, Letty.
Hi, Greg. Sorry, one more question. Since we're talking about kids, what's going on with kids stutter, and is there anything that would help them with the stuttering?
Stuttering. Boy, I have some notes on that. It's been a really long time since I've treated that, but I have treated that. Let me think about that. Is there somebody in particular you're thinking of?
Yes, I have a student that I'm gonna have next school year. He's gonna be a senior, and he stutters quite a bit. And I was just wondering, like,
Try the African bluegrass. You know, because a lot of times it's tied to you know, on that weekend when we're doing the self-esteem and set part 2 and part 3.
yes.
You know, part of it is we're going to be addressing things that have to do with like part 3 is tied to like the physical body, how you present yourself, like even like things that you're attracted to and do, your possessions, things like this, you know, because they're all like expressions of yourself. So it's actually tied, the stuttering is actually tied to this. And this sounds really weird, but it's tied to the sexual instinct, right? It's tied to sexual instinct. And so sometimes you have to go through and re-educate the sexual instinct. And it's not about sex. It's about how you present yourself to the world. You know, so potentially attracting a partner, but attracting like people, like if you're in business, you know, it's about like how you present yourself and how you attract things into your life. And so, and even the things that you're drawn to, like, oh, I want to get this kind of car. This kind of car really resonates with me. That's still actually tied to that instinct. And so, you know, you're probably not going to be able to get through and do a lot of like deep healing with the person to go through and do it, like how we're going to do in that day. But African bluegrass will work for children and like teenagers. But as they get older, like for an adult, you know, depending on what phase is impacted, you know, which we're going to go through in that class, cinnamon or cassia can help. Nutmeg helps with the agitation. If you're not sure about any of it, you could use that Abramelin blend. You know that Abramelin blend? You can just like diffuse that in the room, and sometimes
Okay.
that's helpful. Because the stuttering is tied to like their expression, and it's like how like they start to get nervous about like it's not about like a potential partner, but like, are you going to judge me? Are you going to think negatively of me? Are you not going to like me? Are you, you know, whatever it is, all of that is tied to the that instinct. And so it's more about like expression out in the physical world and like how you present yourself. And when they have a difficulty there, it can manifest in like how they talk. So it could be stuttering, it could be talking really quiet, it could be not wanting to talk in front of people. It could be, you know how like sometimes you see this a little bit more in young girls, like they'll wear like really loose baggy clothes because they don't want to present themselves as being like a young woman or you know, in the process of becoming a young woman, you know, things like this. This is all tied to that instinctual response. And so people will have issues there for a whole range of reasons. Most of it is nothing to do with something sexual. It usually has something to do with you know, they got judged, or there's a lot of pressure, or you know, there's usually like peer pressure. You know, it could be some traumatic event. It could be, you know, in extreme cases, it is tied to some things that happens in abuse and things like that. But sometimes it's a neurological issue. Sometimes it's an endocrine issue. Like you take males like in their early 20s, mid 20s, and they're really having this issue. It's usually a testosterone issue. Like they probably have like low testosterone. And so you go through, you treat the testosterone, and all of a sudden they break out of it, right? You don't want to do that with a teenager, but you know, mid 20s, late 20s, early 30s, you know, even later, but like you would start to see that manifestation as they're becoming like a young adult. And so they might also manifest like, I feel uncomfortable going and interacting with people and putting myself out there in groups and crowds. That's still a little bit of sexual instinct. You know, it's presenting yourself, right? And so with that, the things like the Abramelin is a good general way to do it, but in you know, in re-educating that, there's a lot of cinnamon, cassia, calamus, myrrh, nutmeg, palo santo, aloes. Aloes does a lot for helping you like shift and change out of all kinds of things for almost every system, right? So, but it's not always the most practical thing to do because it's a bit expensive and things like that. So you could always supplement, in this particular case, Palo Santo for that. Basically, it helps the person to shift or change, because even as you go through it, starting to shift this with the person, you might start like calming down agitation. You might start like fortifying things and purifying things and regenerating things. Still, there has to be the ability to change the shift in the physiology, the shift in your reactions to things in the environment, the shift to how you feel emotionally and mentally. And sometimes there's been so much agitation, it's caused so much stress that even though you go through and you treat all these things, they have a very minimal ability to shift or change because of all the past, right? And so, you know, we're going to talk it through and practice this when we do that day for the self-esteem. But in a nutshell, you could start with the African bluegrass, and if that's not helping, switch to Abramelin.
Okay, thank you. Greg, would that ever be, is it a possibility for that to be genetic? Because
yeah.
the dad also stutters.
Yeah. Genetic could also be like emotional patterns. So it's not necessarily like in the genes, but it could be behavior that gets kind of learned. It could be like agitation in certain parts of the nervous system or endocrine system. The child could also have that, but it usually can be unwound, you know. There could be some limbic functions that it could be. And so, but you know, for a child, they're taught how to present themselves to the world by watching and interacting with their parents. And so if one of the parents has an issue, sometimes the child might have the issue too. And it doesn't mean that the parent did anything wrong. It's just we all got something, you know. And so it's something that the child just needs to work through, and it can be treated and get better. Every once in a while, there's something that's like pretty genetic about it, but most times when I've treated stuttering, a lot of times it didn't even take a long time of treating it. You know, you might need to tune it up from time to time. Like if they start to get stressed or they start to get self-conscious, they'll slip back into it. But, you know, think of it like, it's kind of like depression. Sometimes depression is too much introspection, right? You could say the same sometimes for like stuttering. It's too much like being self-conscious and not like just putting it out there. Like, you know, somebody who's stuttering is usually not super confident and putting themselves out there, right? You could say it's because of the stuttering, but usually the lack of self-confidence is causing the stuttering. And now, if it's like a teenager, I would stick with what we're saying, but like in that self-esteem class, one of the things that you would use also is jasmine. Jasmine's really good for fortifying like confidence and things like that. I usually use that in somebody that like late teens, 20s, like, and then anything after that, like 30s, 40s, 50s, 60s, whatever. But it's to stimulate self-confidence, but here you would use it to stimulate self-confidence to reduce the stuttering. But like say they just had a hard time of like they're good at something, but they have a hard time putting themselves out there. Jasmine would help them do that, but in a way that's very soft and gentle, almost kind of playful. Where cinnamon makes you like go, oh, let's get out there. Jasmine goes, let's get out there, but let's play with it, if that makes sense.
Yes,
So
it does. Thank you, Greg.
We got to switch to the angel class. And so next week we are traveling on Tuesday. So we are going to do this class on Monday night. So it's not changing all the time, but just, I didn't want to skip it for next week, but we're just going to do it on Monday night instead of Tuesday night. So we will remind you with an email and, you know, next few days, or I don't know how Samantha's going to do it, but we'll do this class on Monday and the angel class on Monday as well, because I'll be traveling Tuesday night. So anyway.